All right. Hi, everybody. We're joined today by two members of our medical advisory committee to share with us some information about the decisions that are being made at that level, the advice given to us. I'm Eliza McLaren, Associate Head of School, and I'm going to pass it off to the two of you to introduce yourselves. So, Dr. Parekh.
Thanks, Eliza. I'm Anand Parekh. I'm an internal medicine physician by background and have two daughters, Isha and Annika, in the lower school.
Dr. Turner.
I'm Margaret Turner. I'm with Annapolis Pediatrics, so a pediatrician in the community. And I have a son who graduated last year and a son who's a junior, currently Cole.
Well, thank you both for being here. Like I said, the main goal here is to kind of pull the curtain back a little bit on our medical advisory committee conversations and share with our community some of what we're considering and thinking about. So on that, the first question is, can you share your perspective and the perspectives that we heard at the recent medical advisory meeting about where we are with COVID-19 and how we as a school should be responding?
Sure. Well, I think the first thing to say is just a thank you to the Creek community, because the community has just done so well with the pledge, and thanks to the school, everything that the school has done, from masks to physical distancing to ensuring the ventilation systems are proper and cleaning and disinfection, screening. The school has just done well, and the community has done so well, and I think that's what has allowed us to get to this point, which is a decent amount of in-person learning over the last couple of months. I think, Eliza, what we discussed at the advisory meeting yesterday is that while the school is doing a great job and the community is doing well, we can't ignore what's happening around us. And what's happening around us, particularly in the community, in the county, in the state, is really a resurgence of COVID-19. The first indicator you always want to look at is something called the positivity rate. What percentage of tests that are being done are positive? And most people think that about 5%. You want to be lower than about 5%, and that's an indicator of sufficient testing. Anything above that, you really lose your eyes. You just don't know enough about the transmission of the virus. And when you look at the county, you look at the state, we are now above 5%. The second thing that has concerned the advisory committee then is even what we can see, just a trend really going in the wrong direction, an exponential growth of cases well beyond some of the quantitative metrics that the school had set out early on. And it's really not necessarily an absolute number, but the fact that the trend is as it is, and we don't really see any signs or indication that trend is stopping, particularly as we're now approaching holiday season with Thanksgiving and Christmas. And so I think sort of the bottom line from the advisory committee is, although the school has done so well, we can't, we're not a bubble, if you will. And at a certain point, what happens in the broader community impacts us. And if we don't take precautions and measures right now to really pause in-person learning, then what we risk is the virus that is being readily now transmitted in our environment coming into Creek, and more potentially students and faculty testing positive, leading to then quarantine, disruption of classes and all. And at the end of the day, health and safety come first. And I think that is really the message. And I think that's really what our discussion centered around.
Margaret, would you like to add your thoughts to that as well? Thank you, Anand.
I always, on the committee, I am the queen of let's be open, let's be open. From a pediatric standpoint, we find that the kids are the least severely affected by COVID and the least likely to be transmitting COVID. So from a pediatric perspective, we've been very pro-open the school right from the get-go, from July. But at the same time, the numbers that we're seeing now are concerning me. I am, for the first time, really starting to feel very strongly that it's too high for us to safely be open. Kid risk, but because of the number of people that are going to be positively impacting our kids, causing the number of quarantine, and really, just bringing disease closer and closer to our community. And I think that it starts to take on, we focus constantly in our ops about safety and access. It's the twin pillars of being open is how much is safe and how much access can you provide safely for staff, for clients, for everyone. And I think right now the balance is shifting towards we are safer for everyone by shifting back to a virtual model. I'm continuously impressed by the virtual product that Creek is delivering. It is an exceptional product. And certainly at the upper school level, I have more experience with the upper school model, but the kids love it. They like it better than any other school that I've seen. So I feel very confident that they're getting a great product virtually, and then we can continue to provide the safety that the entire community deserves.
There's a really heartbreaking element to this moment of realizing that health and safety is at odds with in-person instruction. As we look to the coming weeks and months, possibly, what are you looking for with COVID, both in our community and external metrics, in order to advise us that we're ready to come back? And what would coming back look like from your perspective?
Well, I think, unfortunately, Eliza, things are likely to get worse before they get better. And we have some important holidays that are coming up, and everyone should be celebrating those holidays. We just need to do it in a smart and safe way, whether that's virtual, whether that's in person, just with immediate family. If you're required to be with people outside your immediate family, to take all the, whether that's testing and quarantining, masks and physical distancing. The greatest thanks we can give is by making sure that we keep people healthy around us. So, but that being said, we know, just looking at holidays over the last several months, whether it was Memorial Day, whether it was 4th of July, whether it was Labor Day, that we have seen specific upticks in the number of cases and hospitalizations and such. And now we're in the winter where we're all congregating indoors because of the cold weather. And so as much, even if everyone, does what they're supposed to, we are likely going to see, continued upticks. And, I think, and Dr. Turner knows as well, I think where we really get concerned is when we see this healthcare surge. And right now around us in hospitals all across the region in Maryland, hospital beds are filling up, ICU beds are filling up, there are staffing shortages. And that's really when you get into dire straits in a pandemic. It's that time when the healthcare system is absolutely overwhelmed that you need to actually, unfortunately shut everything down. So to prevent us from really getting there, we need to take the steps right now. But Eliza, unfortunately, I think the numbers are going to get worse before they get better. And I think we're just going to have to see where we are after the holidays towards the first of the year. And what we're really going to be looking for is, are we doing better testing? Is that positivity rate below 5%? So we have our eyes, have those cases not just plateaued, but has there been a decline over 7 to 14 days, a sustained decline, so we know we're on the right track. Those are, I think, some of the things that we're going to be looking at before we can say we can go back to some in-person learning. And then I think, as Dr. Turner said, once we do that, we're going to have to start gradually again. And so sort of in reverse of our color-coded scheme there, and probably, first focus on the lower school and limit the duration in terms of half days and all. So some of the orange, I would say, is probably how we would start. So sort of a gradual reopening once we're in a position to be at that point.
Anything you'd like to add to that, Dr. Turner?
I think that sums it up beautifully. I wish that there was better news. I wish that there was, it is grim news, and I think it's important news to hear. But we are anticipating a rough couple of weeks here. And we're very lucky we can do a lot of our work virtually. But, a major piece of this is that we also have cold and flu season is upon us. And so it isn't just COVID that we're worried about. Kids get colds, kids get flu, kids get RSV. And I think we have to keep in mind that there's a lot of other illnesses out there that do affect kids preferentially. And we've got all of that coming together in this sort of perfect storm. And this is what affects kids. This is what keeps me up at night. So I do think we really have to look at all of this and see how it's all going to play out, and just be really cautious and careful as we come back.
So listening to the two of you, I'm reminded of a conversation we had way back in August about our goal really being to prevent transmission on campus of COVID-19, and that we were instituting all of these layers of protocols that, when added up, would really mitigate our risk of that transmission happening on our campus. In other words, sort of controlling what we can control in this environment. And we were comfortable that with those protocols in place, we could weather significant, or some rise. We've seen little surges happen in the previous weeks and months, and we've said, okay, we're still okay. What's different this time? Why are we looking at this now and saying that our protocols aren't sufficient any longer to warrant in-person school?
Yeah, well, I think just starting from the metrics, we've never seen numbers like this, whether it's the positivity rate, whether it's the daily cases in our region. Again, we're quite concerned about the healthcare system. And so, again, I think it comes to a point where we can be doing everything as well as we can. But we also live in a broader community. And if there's such significant transmission ongoing, then sooner or later that the virus is going to be brought to the Creek community in numbers, and I think we don't want to risk the health, of course, first and foremost, of anyone in the community, and I think that's and so the situation in August is pretty different, and of course now we're getting into the winter months, so that's and the holiday time, so that adds to the gravity, I think, of the situation.
One of the best examples of sort of the protocols we take and the precautions we've used is to imagine each one of our, like the 3 W's, the washing your hands and the watching your distance and wearing the mask, as a layer of Swiss cheese, that none of them is perfect, but that if you layer each piece of Swiss on top of each other, you will have less holes and they'll be less porous. And I think at some point, you're going to overwhelm those holes and it will start to leak through. So if you will, our layers of Swiss can only protect us so much. and at some point, the amount of virus is going to just be too much for our excellent protocols. And I do believe very strongly our protocols are the best in the county, but it's getting to be too much.
So another looking forward, recognizing that predicting the future is tough, but we do have some news coming out about vaccines, it seems. Where do we go from here? What are you hoping for? But what is there anything we can be optimistic about here looking ahead?
Well, I think the vaccine news is really, really promising. And I think the next couple of weeks, we may in fact see a couple of vaccines that actually are found to be both safe and effective from the FDA. But a quote that I've been hearing lately that I think makes a lot of sense is vaccines don't save lives, vaccination does. And the manufacturing of the vaccine has been amazing. But unless we ensure that it's distributed and then there are shots in arms, and we can ensure that there's enough confidence we can, take on vaccine hesitancy. Unless we can build trust and make sure that people actually get the vaccine, we're not going to really, that's really our ticket out of the pandemic. But we're not going to get there until we can get people vaccinated, and so that's going to take time. So even if we get some vaccine by the end of the year, there will be priority groups. Likely healthcare workers and essential workers, those over the age of 65, those at highest risk for severe complications. For the general population, it's going to take time for vaccine to really be produced and distributed. And this is a many, many month process. So while I guess this is a light at the end of the tunnel, whether it's the beginning of the end or the end of the beginning, I don't know. But while we wait, that message of the 3 W's, as Dr. Turner mentioned, and everything that we're doing we're going to have to just keep continuing to do that. And that is a really important message. So I think the vaccine is sort of a sign of hope, but it's going to take time until that materializes and changes in what we do. I would say the other thing to look out for is testing. Will there be advances in testing over the next couple of months, which the CREEK can actually into our current protocols? And we don't quite know yet. Some of it depends on how good the tests are, how readily available these tests are, how quickly you can get a result. But could we somehow early in 2021 incorporate that into our regimen, and that could be very helpful as well. So I think there are a couple of things that the advisory group is going to continue to track for leadership.
Yes, to me, as much as I love vaccines, and we vaccinate here, and we're very proud of we maintained a 94% vaccine rate even during the shutdown, which was well above the national average. And we will, as soon as there's a COVID vaccine available that we can distribute, we will be on that. But kids are not going to be at the forefront of that. So kids are not a high-risk group, and so they're going to be at the bottom of the list. They've not been studied in kids yet. So, we keep trying to preach caution and patience, because kids are not going to be at the top of this list for vaccines. So that's not going to be a quick fix for us. So we need to keep working on the 3 Ws. But the testing is really encouraging. If we could get a rapid test that's accurate, a quick daily test, that at-home test that would be approved, that you could do every morning before you left the house, that's ready in 30 minutes, that's a game changer. And that does make everybody a lot safer. You know who is infected immediately. People can be excluded instead of this very clumsy 2-week quarantine for any exposure, 48 hours proof. It is an incredibly clumsy system right now of trying to minimize exposures. We need something much more surgical in order to try to improve our knowledge of who's infected and who's not. So testing is what I'm hoping for.
Thank you both. I think this has been a lot of really great information. Maybe we can wrap up with a sort of a general question. Is there anything else you'd like to share with our community?
Thanks for everything you're doing, and please continue to be safe. And this is a difficult time for everyone, but we have to persevere and thrive, and we're all in this together. So and please reach out, if we can be helpful, and if you have any questions.
Absolutely. Stay healthy and happy Thanksgiving.
Thank you both very much. I'm pressing stop record now.